Thank you, Todd, and thank you, Linda, for those two marvelous introductions and presentations. I know that my old golfing buddies Chuck Miller and Jack Mullen are saying that was too generous, just absolutely too generous. But I'm telling you, I intend to believe every word of it. I don't know about you. This doesn't happen to you very often. When I was listening to it, I began to think about the time that my father was asked to preach the funeral of the biggest scoundrel in the whole county. And there's nothing that he hadn't tried, and for the most part been successful. That is the scoundrel, not my dad, that is. And my father was incapable of saying anything unkind about someone, so he went on and on and on about this poor deceased. And finally he paused to take a sip of water, and all you could hear in that moment of silence was the widow saying to the oldest son, "Henry, run up there, peek at the casket, see if that's your daddy he's talking about up there." I began to wonder, who are they talking about up there? Couldn't possibly be me. No, that isn't I. But I've had a lucky and a wonderful life. I really have. And part of it is because of those friends that helped you along the way. Mary Ellen and I retired to Hilton Head. We had planned a fairly routine retirement, you know, eating good restaurants and travel and that sort of thing. But it didn't quite work out that way. I soon discovered that 1/3 of the population had no access to health care at all. And looking around for a solution, I noticed that several retirees from the medical profession were there and had no way to deliver it. So I brought those two together and made a solution out of it, which we call the Volunteers in Medicine Clinic. And when I did, I embarked on a journey of joy that has eclipsed anything and everything that I've ever done in the past. There's nothing quite like that. I invited the town to come join us. They did. Built a new 7,000 square foot facility with 6 examining rooms, eye clinic, 3 dental offices, x-ray and laboratory, and a pharmacy. Dedicated it debt-free, without a dime of federal, state, or local government money touching it. Indeed, had money in the bank. And in fact, when we did it, then Governor Campbell said that this is just citizen helping citizen, which is citizenship at its best. And I think he summarized it pretty well. We, through that effort, transformed that town from one in which 1 out of 3 had no access to health care to which everyone had access to health care. Now, mind you, these were not the lazy scalawags that some people had described them. These were the working poor, part of the 45 million working poor in America. They work to lift themselves out of poverty, but they do not make enough money to allow them to provide health care insurance for themselves and their families. But this is the group that we wanted to help, and we did. And as Linda said, we are probably the only town in the nation where everyone has access to health care. But the question that I also asked myself is, how do we want to organize this event? We decided that we did not want to consider those that came to us as patients or diseases or illnesses, but rather we wanted to perceive them as friends and neighbors who did not feel well and would come with us to see if we could help them. And our 2 guidelines were the golden rule, do unto others as you would have them do unto you, and the second commandment of Jesus, love your neighbor as you love yourself. And when you combine those two, you have the ultimate of caring, I think. You don't need to look very far beyond that. When someone comes to the door, there's someone there to greet them and says, "Good morning, good afternoon. I'm sorry you don't feel well. Come in and let's see if we can help you here." And if they have children, we invite them to leave the children in the children's reading room, where someone will hug them and hold them and read to them. And when they leave, we insist that they take those books home with them. If you have other children, take books for them as well. Then we introduce them to their escort. Remember, the group I'm speaking about had no heritage of the part they played in the drama of health care receiving and delivering. So the escort takes them through the eligibility process, the registration process, and seats them in the reception room. We don't have a waiting room. If you have a waiting room, things are what you call it. They sit there and wait. But no one sits in our clinic 15 minutes without someone sitting down and visiting with them. Not about their disease, not about their health, but just those threads of life that weave friendships. And when it's their time to go to the back, that same seamless weave of caring goes on back there. And when they leave, if they have time, and we do, we want to have an exit interview with them. How did we do? What did we do that we shouldn't have done? Or what should we have done that we didn't do? Do you have a prescription? Do you understand it? If not, we'll get a nurse out and help you explain it to you. Can you afford it? Let's see if we can help you with that. But the next thing is probably the most important thing of all. The escort will ask them something along the lines of, how is life treating you? How are things going in your life? And at that point, the escort is expected to listen with energy. Now, that's as different as looking through the window and seeing the dust and the handprints, fingerprints, versus looking through that window and seeing the beautiful view beyond it. Listen to what they're telling you deep inside them. And we've learned that what we had at the outset are representatives of two totally separate and disparate constituencies. One fairly well off and one not well off at all. But what we have at the end, though, are just two decent human beings locked in a moment of sharing and caring, each knowing that they and the other needs healing, and is that moment being healed. And when they go out, they're different, and so is our town. That's how we're transforming our town into a community. In fact, it's beyond there. We're going beyond that. This past February, we received the Community Service Award from the Dr. Martin Luther King Jr. Celebration Committee. And when I went up to accept it, it dawned on me for the first time that in that slice of health of our town labeled health care, we not only have created a community, but we have created the beloved community, the vision that Dr. Martin Luther King had for the whole of society. Because in our town, we not only care about them, we care for them ourselves. We don't run out to get a federally funded program for them. No, good gracious, that would rob us of the joy of giving and receiving. We say, we love you, we're going to care, we care about you, and we ourselves are going to care for you. Now that is the beloved community. But if those students are here wondering, what in the world is the payback for all of this? Well, it's simple. It's joy. I mean, pure, unadulterated joy. Now, we need to draw a distinction between joy and fun. We use those two words interchangeably, but they're not the same at all. Fun is described as playfulness, merriment, sports, pranks, frolic. Yeah, important, yeah, but that's fun. But joy, that's something else. That's a deep personal feeling. It's ecstasy, it's rapture, it's glee, it's delight, it's happiness, beatitude, and transforming. It's all of that and more. In fact, it is so marvelous, I don't think the words exist in our language to fully describe it. There's certain characteristics that joy has. If you think you deserve it, or you chase after it, you won't find it. It comes to you when you least expect it, and is the most marvelous surprise when it happens to you. It's not only inexpensive, but it's free. All it costs is for you to give yourself in service to another without expecting anything in return, and you put yourself in a position to experience joy. Joy is a deep personal feeling, and it is personal. It's yours and yours alone. You can experience it in concert with others, but your joy belongs to you and you alone. You can't give it to someone else, because it is a gift from above, a message of thanks to you. And joy binds you to the recipient in a pact that's stronger than any contract you could write. If I had one wish for each of you, it would be that you would have eyes to see those that are rendered invisible and excluded, and open arms and hearts to reach out and include them. healing hands to touch their lives with love, and in the process, heal yourselves and discover joy. Thank you.